necessarily condemn someone who, was suffering and needed treatment.
I've talked to a lot of these people.
Yeah,
and yes, they would.
Yes, they would. Well, let's hope none of those women ever find themselves,
in a really serious
or their
situation.
loved one, in that boat, because the fact is that women kill themselves, women kill their babies. Infanticide is
postpartum psychosis is something people don't really understand. It's postpartum depression, which I think people are aware of, but there's a more insidious syndrome called postpartum psychosis,
right.
which
postpartum depression left untreated. Some of those women will go on to evolve into a postpartum psychosis,
and some will have just a psychosis flat out.
And in fact, presentation of bipolar disorder often comes in the form of postpartum mania.
Yes, and those are the ones that we had that case down in Texas where the woman drowned her kids in the bathtub.
She probably had schizophrenia.
Also, I see.
Yes, Andrea Yates had probably schizoaffective disorder and had symptoms of schizophrenia as well as having some mood issues on top of it. But her, what happened to her at that time was an exacerbation of the psychotic symptoms of schizophrenia. But again, another extremely terrible, debilitating illness that needs treatment. And in terms of, I know that ECT, electroshock therapy, for many people, gets a terrible, terrible rap. And unfortunately, that's, I think, out of, years of it looking very barbaric and frightening. And in fact, its origins were really in, diabetic coma, putting people into, diabetic shock, essentially, and inducing seizures as a treatment in the days, again, when people the field was in its infancy and it didn't have much to offer. But ECT is a remarkably effective treatment for severe depression. Now, we're not talking, mild to moderate depression, but if you've got a severe...
That means, and also you've been through all the medications
and you've tried medication, or you are so actively suicidal that honestly you can't wait weeks for medication to kick in.
And let's describe, because I've seen ECT or electroconvulsive shock therapy work unbelievably well.
Oh, it's incredible. Within a day.
I mean, what all you're doing, you're running a current through the brain that raises the chemicals that the medication raises well, and does it very powerfully and leaves them apparently more enhanced, let's say.
Exactly.
And what you do is you go to sleep. You're paralyzed for 15 or 5 minutes.
The things that used to be scary about ECT, which is, before they paralyzed you temporarily, and it is very temporary, you never feel that. In other words, some people are frightened, I'm going to feel paralyzed. You're asleep before your muscles are...
It's the same thing you use in anesthesia.
Exactly.
And they control the airway, and you're out in 3 minutes, and that's the end of that.
You wake back up again, and some people do have some... memory loss for the time surrounding the ECT, or even ongoing can have some memory loss, but it's usually pretty minimal. It often comes back, in fact, all the way. And the fact is, I think what people have to understand is that when you're talking severe depression, you are talking a 15% mortality rate. 15%.
That's a conservative number.
And that is a conservative number.
Yeah.
Will kill themselves. Not will attempt to, will kill themselves. And so, when you're talking about a deadly disease, you have to be serious about it. And ECT is, really probably the most effective treatment for depression.
I'm surprised that you didn't know that what Tom Cruise was talking about on the Today Show was one of the basic principles of the Scientology culture.
I know that it's a principle, but, look, there are lots of people who subscribe to a faith or an organization who don't necessarily subscribe to all of it, right?
Okay.
I mean, look, there are many people who would say they're Catholic who use birth control,
Right.
There may,
right.
I'm just saying, so I suspect there are plenty of Scientologists who feel that it benefits them in many ways and don't necessarily feel that they need to proselytize against psychiatry.
That's true. In fact, many of the more moderate Scientologists I've talked to just feel like it's a helpful thing to them and it's been useful and it's a good thing, and they're not, again, not proselytizing in any way. It's just been a part of their life that they found kind of helpful.
That's right.
And God bless them.
Oh, Lord, this site says psychiatrists and psychologists have raped 250,000 women?
That's probably true, right? I mean, about throughout history.
Well,
I mean,
my colleagues been? I don't.
No.
I
I'm well. Listen, I deal a lot with that with people. Listen, in California, there's a lot of misbehaving people in positions of authority. I wouldn't, not thousands and thousands, but hundreds and hundreds, and maybe thousands. And
that 10 to 25% of psychiatrists sexually assault their patients?
No, through history. They're talking about throughout all of history, they're estimating that. I mean, it's, it happens.
This is what this says. Studies show that 10 to 25% of psychiatrists sexually assault their patients.
No, that's not true.
And of every 20 of these victims, one is likely to be a minor. I mean,
no, that's ridiculous.
Come on.
All right, but be that as it may, I wanted to quickly talk about the crap storm I got into with them, which is apparently I was shooting. I haven't read this article yet that I did for Playboy because I'm always afraid to read what they print about what I say. But what I was saying was, and to clarify my position, because Tom Cruise's people reacted rather venomously,
I see.
Was
surprise, surprise.
Yeah, which was that I used the word cult in applying to the Scientology, and I apologize if people take that term to mean anything pejorative.
What was the term?
Cult. I said cult, or cult-like or something.
Yes.
And I don't mean, listen, all churches start as cults. That's a fact. And so I use the term very broadly, and I'm sorry that I didn't qualify it a little more specific, because I really don't have any. I actually had stronger opinions until I talked to both sides of the coin. I'm sort of moderate on the whole thing. If people want to do that, whatever. I'm worried about that museum because, again, it's propagandistic, and I'm interested in the truth, so that bothers me. But I really don't have no strong opinions about it. And I said it's what makes a guy like Tom Cruise, who seems to have so much and seems such a great guy. And by the way, he gets high marks from me in this recent movie Tropic Thunder. What would attract him to something like that? And what I said was, it's well documented in the public domain that he had all kinds of, he was moving constantly throughout his childhood, and he had some abuse issues, and feeling abandoned and abused. These kinds of inclusive environments are very alluring to somebody with that history. And my point was, we don't ever look at these things realistically and have a conversation about it as an opportunity to learn, not to knock down Tom Cruise for his choices. That's up to that's up to him. But for us all to kind of look at that realistically and go, why does he jump down on the couch? Like, well, let's examine what's going on with him,
right? Why
he would do that, and not to hurt him or to make him feel diminished by that. It just to understand him better.
Well, psychoanalysis is the field all about understanding. It's very hard for people, you tend to identify with one thing or another, and you're for me or you're against me. And I think, as you're bringing up when you use the word cult, the stronger the identification, the stricter the line of, we are black, you are white, or,
right.
Vice versa, the more the tendency to, this is good and that is bad. And if you're going to tell me, in other words, the need to stay within the group and say that things outside the group aren't good.
Right. You can't challenge anything because it threatens the connection.
It weakens the group.
So,
It weakens the group, and that is we won't use that word, but that is group dynamics.
Right.
And we're seeing that politically. We see that in various faiths, and we see that in all kinds of groups.
And again, my only concern is that it hides the truth. And let's all just examine. You can adhere to whatever you want, but let's just examine what's true and what's not. I think we lost. Take a break.